Hi, my name is Sam Hughes, and I'm a first-year nursing student at the University of Michigan. My clinical is at the VA and the Community Living Center. Now I'm going to present to you a patient. The patient is a 58-year-old divorced Caucasian male. His former job was as a painter, and he is a Navy veteran. He was admitted to the VA CLC from his assisted living facility for wound care treatment due to a scabies infestation. Vital signs. Oxygen saturation was 95%, blood pressure was 142/66, pulse was 68, respiratory rate was 18, temperature was 97.8 degrees Fahrenheit. Reason for seeking care. Patient complains of itching of lower back, thighs, and sides of thorax and painful sores on his legs. History of present illness. Patient complains of intense itching, which began in December. Patient reports that the itching is constant. Upon examination, he proves to have open sores on his feet and legs. He was then diagnosed with a scabies infestation. He refers to the sores as a 5 on the pain scale with no alleviating factors and states that the chronic itching worsens at night. Past medical history. Patient reports that all of his immunizations are up to date. He reports no medicinal allergies. However, he says he's allergic to cat dandruff. He states he had chicken pox as a child, and he also reports hypertension and osteoarthritis. He states that he underwent an ACL reconstructive surgery in 1979. He is currently taking insulin for type 2 diabetes mellitus, 81 milligrams aspirin for pain, 40 milligrams furosemide for hypertension, 300 milligrams lithium carbonate for bipolar disorder, nicotine patches, and 100 milligrams tramadol for pain management. Functional assessment. Patient has a 30-pack year history. However, he reports trying to cut back on his cigarette use. He also reports past abuse of alcohol and methamphetamines. Patient denies eating difficulty and states that he eats 3 healthy meals daily. However, medical staff suggests that sugar intake should be limited to help manage type 2 diabetes mellitus. Patient also reports having difficulty sleeping every night. Medical staff has recommended limiting caffeine intake, as it has been observed he drinks 4 to 5 cups of coffee daily. He uses a wheelchair and shower seat as assistive devices. He reports that he performs upper body workouts 2 to 3 times per week. Psychosocial data. Patient reports isolation from his family. He was married for 6 years and he has 2 sons, 13 and 31, whom he does not speak to on a regular basis. Patient is neither spiritual nor religious and identifies himself as an atheist. He reports graduating high school in 1975 and denies attending any university. Family history. Patient states that both parents are deceased. He also reports that his father had type 2 diabetes mellitus and osteoarthritis, and both parents suffered from hypertension and obesity. Patient also states that heart disease runs in both sides of his family. He reports that his paternal grandfather passed away from a myocardial infarction. Review of systems. Patient stated that I view my health as okay. Integument. Patient reports extreme itching on legs, back, and sides of thorax. He says that the itching began around December of this year. He reports that he noticed small red bumps on his legs, and he is currently concerned with the ulcerations. During his service in the Navy, he states that he has received numerous sunburns. However, he denies using sunscreen. He also states that he noticed his hair thinning and excessive skin dryness. Neurological and mental status. Patient denies any numbness or tingling. However, he states that he has experienced paresthesia bilaterally in his lower extremities. He reports no history of seizures or loss of consciousness. He states that he has no concerns over neither his memory nor his ability to concentrate. However, he expresses that he suffers from insomnia. He continues to say that he has difficulty sleeping every night and he does not feel tired and therefore cannot fall asleep. Patient reports no unsteadiness or loss of balance or coordination. Patient articulates thoughts and does not appear to have expressive aphasia. After asking, he confirms that he does not suffer from any difficulty speaking. Patient denies any past history of head injury. He has a history of type 2 bipolar disorder and schizophrenia. Agitation and depressive moods are managed by taking lithium carbonate, 300 milligrams in the morning and 600 milligrams at night. Physical examination. Integument. Upon inspection, the scalp appeared to be dry and had a small amount of flaking. Hair distribution was even, texture was smooth, color was gray. Patient appears well-groomed and he has no detectable body odor. His skin color appears uniform throughout and does not display erythema. Skin is warm to the touch and excessively dry. When testing for trigger, skin stayed tinted momentarily before returning to its original position. Patient has tattoos on his hands, forearms, and chest. Upon examination, a scattered macular rash was observed. The rash was red with a small black crust. Patient has multiple ulcerations bilaterally on his lower extremities. On his right foot, there was an ulcer approximately 5 by 9 centimeters, which was 40% red and 60% yellow slough. There was a small amount of serous drainage, and the perimeter was without redness, scabs, or scales. On his left foot, there was a 2 by 4.5 centimeter pink wound. There was scant serous drainage, and the perimeter was without redness. Patient has questionable gangrenous toes. Patient admits to biting his fingernails, and his fingernails are securely adhered with a brisk capillary refill. Neurological. Patient is alerted and oriented with person, place, and time. Speech is clear and vocabulary is appropriate for age and the setting. His cough and gag reflex are present. Pupils are equal, round, reactive to light and accommodation. They appear to be roughly 2 millimeters. Ocular movement is intact in all visual fields in all directions. Patient has full and symmetric sensation bilaterally in upper extremities to light touch, firm touch, and pinprick. However, in lower extremities, the patient has difficulty distinguishing pinprick from light touch bilaterally in lower extremities. No ankle clonus is noted. Due to the wound care dressings, a Babinski test was not able to be performed. Patient appears to have no problems with attention span and was able to count backwards from 100 to 65 in intervals of 7. He appears to have reasonable judgment because when presented with a scenario of a flaming trash can, he stated that he would go get help. Patient proves to have abstract reasoning when asked to draw a clock. Pertinent systems. Peripheral vascular. Upon examination of the peripheral vascular system, it could be hypothesized that all pulses would be equal in strength bilaterally. Temporal pulses would be graded as a 1+, carotid pulses would be a 3+, brachial pulses would be graded as a 2+, radial pulse would be a 2+, femoral pulses would be a 3+, popliteal would be a 2+, dorsalis pedis would be a 1+. Edema could be expected bilaterally in the lower extremities due to a sedentary lifestyle and tissue damage from the scabies and excessive scratching. Upon examination of integument, patient has questionably gangrenous toes. WebMD describes gangrene, a condition when body tissue dies by lack of blood flow due to an underlying injury. Additionally, the patient suffers from type 2 diabetes, which can often be an underlying cause of dry gangrene. The excess sugar running through the blood causes peripheral neuropathy and hardens the walls of arteries, which causes blood flow obstruction. Musculoskeletal. Upon examination of the musculoskeletal system, it could be expected that there would be muscle atrophy bilaterally in the lower extremities as he could only walk a few steps. Right and left lower extremities would be graded a 4 out of 5. Patient reports performing upper body workouts 2 to 3 times weekly, so it could be expected that right and left extremities would be graded as a 5 out of 5. Patient reports having osteoarthritis that causes pain as a 6 out of 10 on the pain scale in the lumbar region of his back and in his knees. According to SpineHealth.com, the mechanical breakdown of cartilage between the vertebrae causes immense pain, which could be expected to affect his gait and posture. He could be expected to have full range of motion bilaterally in all joints in the upper extremities. However, patient could be expected to have limited range of motion in lower extremities as evidenced by wheelchair use and reported osteoarthritis in his back and knees. Thank you.